Thank you, everybody. This has been such a wonderful day of discussion, and I think certainly we have a lot to work with as a community and as National Health Council helps lead us forward. I do think there have been a number of themes that have resonated for all of us today, and just maybe a challenge for all of us as we've been working collaboratively to develop this resource and these tools, is that we've certainly heard that funding resources to develop all of this for the patient community are one of the challenges. So maybe for all of us to think about where we may have a role in providing some of that funding to groups, even as groups are developing the use cases and utilizing the blueprint to start. And then for all of us who work in the stakeholder groups and in the ecosystem where these blueprints and the PC-CIS will be applied, to make sure that we're thinking about those audiences and stakeholders who will be utilizing it, so that these PC-CIS will have audiences and implementation downstream. So I do believe we have another poll that Len and I will facilitate. So the poll should be coming up on your screen. Will your organization plan to pursue or partner in development of a patient-centered core impact set? So if everyone could just take a moment and respond to the poll. The questions are: we haven't thought about it, we are thinking about it, we've already started to use the blueprint, we plan to start development in the next 6 months, we plan to start development in the next year, we would like to be a pilot, we will not be developing a PC-CIS, but we'll use them as they become available, we will wait and see, and other. And then maybe once we have the poll results, Len, if you want to take us through those.
Sure. We'll give people a second to respond. So we have our results up here, and it looks like the majority, well, there's not really a majority, 26% say we're thinking about it. So I think that's actually a good start. And for me, that's important because this session today probably has served as a catalyst to get people thinking about it and wanting to engage in this PC-CIS process. So I think it's really exciting. We have 15% who are going to wait and see. Again, I think that's a reasonable approach for some organizations, see how it goes. And probably it could be a time to align with other potential collaborators and partners in the process. So I think that's a really nice result from our final poll. I'd like to thank everybody again for joining us here today. Please remember to complete the evaluation the National Health Council will be sending you as a follow-up to today's meeting. As a quick reminder, the blueprint is out for public comment until the end of August 31st. We'd all love to hear from you and get your feedback. An NHF staff member will add the links to the chat once again. And you can see the links in the chat there that have been posted. Now I'll pass it back on to Omar to close the dialogue and to speak to you about the next steps. Thanks, Omar.
Thank you, Len and Annie, for your leadership and your willingness to be co-chairs of this dialogue. We are very grateful for your participation. This dialogue has not only been so informative, but insightful and energizing. I think the National Health Council appreciates your support and valuable time for participating with us today. This draft blueprint developed by the National Health Council is in progress, and we appreciate your feedback in the open comment section, and hopefully to finalize the draft by this fall. This dialogue has set the foundation for our next steps. So throughout the day, we heard about potential pilot studies, and I want to clarify that the National Health Council will be leading these efforts, and in the next coming weeks, will develop and put forth guidelines for usage and access to the PC-CIS blueprint on our website. These guidelines will not only just provide a framework for organizations interested in piloting the blueprint, which of course we may have already a couple few, but also to implement their own PC-CIS and how the National Health Council can capture these use cases. In addition, the National Health Council's commitment to diversity, equity, and inclusion is so imperative and positions us to explore opportunities to culturally and linguistically tailored and adapt our resources, including the PC-CIS blueprint that increase patient representatives that helps foster health equity. So please stay tuned for more to come on that. Lastly, I want to thank our PC-CIS advisory board and work groups for their guidance on framing this initiative. A list of our ad board members and work groups can be found at our National Health Council webpage. Also, many thanks to our moderators, panelists, speakers, the National Health Council staff, specifically our communications and marketing team, as well as membership events team for helping us launch the blueprint. And of course, everyone that joined us today for your many contributions to making this dialogue a success. I wish you a great day, and this concludes our multi-stakeholder dialogue on achieving patient-centered core impact sets dialogue. Goodbye, everyone.